when we think of migraine medications, or we think of what do people do with migraines, you look on TikTok, people will say, go to McDonald's, get a salty fry and a Diet Coke, right?
All right, we're on. So, hey, thanks everybody for tuning in to the First Optimal podcast. So we have Michelle Shapiro here with us today, registered dietitian, but she's got a ton of knowledge. She's been featured on a lot of pretty large podcasts and platforms, done a lot of really impactful webinars, functional medicine, hormone health, obviously nutrition, dietetics, and histamines, a lot of that. I'm really excited to get into a lot of that. I'm sure there's tons I'm leaving out, but I would highly encourage everybody, it'll be in the show notes, check her out, her Instagram, and a lot of her other links there that you can check out her platform. But thanks for joining us. Appreciate you.
It's my joy to join and to sit down with you, Joe. Like, your energy is already so contagious and infectious. I can't wait to dive into these topics with you. It's going to be awesome.
Appreciate that. Good stuff. Well, I thought, and I kind of do this a lot, but I hope people enjoy it because I enjoy it. But I want to kind of jump in a little bit to when I talk to people like yourself. You're super knowledgeable. Like, this is not easy stuff to understand, and so it takes a lot of dedication and commitment. So, and anyone out there, like I said, you can check out the content. You can clearly see it just at a glance, but you have your story posted about your personal journey on your Instagram, and appreciate that. But I don't want to tell it. So, cause I think it'd be best from you, but I was wondering if you could just kind of walk through everybody. How did you, get to this point where you are? Like, what does that look like? Talk a little bit about your passion and all that fun stuff.
Absolutely. Yeah. So my career kind of is always dictated by the health experiences I have, because when we are sick, and this is so true for so many functional medicine nutrition providers, we will do anything to find the answers that we need. So we will, go to the ends of the earth to find those answers. And then when I'm seeing clients experience it, it's like times 10 for me. I would rather suffer myself than my clients suffer. But I kind of had two moments of health crisis in my life. I grew up always in a larger body. I grew up in Queens, New York, one of the most diverse, amazing places in the entire world. Actually, my high school is the most diverse high school, I think, in the entire world, which is really awesome. But What that came with was occupying a larger body wasn't such a big deal, because people were all different shapes and sizes and different orientations, genders, races, everything. So I was going to the University of Delaware, which was a much more homogenous environment. And I was like class clown of my high school of 5,000 students. I was, it never impeded me socially, romantically, anything. But I knew going into college, I was not going to have the same experience, because Delaware is, again, much more homogenous and a much different kind of environment. So I was like, I'm going to go on a radical weight loss journey before I go to college. And I lost close to 100 pounds in definitely less than a year. It was very radical and something that I would not recommend. I basically spent the rest of college sick. I just had severe panic attacks, acid reflux, IBS symptoms. Like, I immediately became chronically ill. And every doctor I went to was like, well, why don't you lose 5 more pounds? I mean, that was their answer to a problem that was this total lack of homeostasis in my body, lack of nutrients. And what I think happened was I probably was pouring toxins out from my fat cells as I was in the weight loss process and not properly detoxing them. So I think that was what happened. But I then just was sick. Again, I was this I had 5 panic attacks a day. And after college, I sought the help of a naturopathic physician. In addition to what I made as my first, I call it a battle plan. It's corny, but I still call my client plans battle plans. But I basically read as many books on anxiety, as many books on functional medicine as I could. And I just kind of while I was in my dietetics schooling, I just wrote, how do I target anxiety from all of these angles? And I just wrote it down, like lifestyle, supplements, nutrition, anything. And then when I got 80% better, my panic attacks were 80% better, I sought the help of a naturopathic physician, Dr. Robert Kochko, who in my first appointment told him, you think that you're my doctor, but we're best friends now. And we are best friends to this day. But basically, it was the first time someone sat with me in a 2-hour appointment. And I was like, oh my God, I want to be a functional or naturopathic, guided dietitian. And that's really my recovery from that huge homeostasis shift is what led me into the first leg of my career for about the first 5 to 6 years of my career, which was, how do we lose weight in a way that doesn't make us sick, either mentally, physically, whatever it is? How do we bridge the gap between this disordered eating world, body positivity, but still weight loss? And also, how do we eliminate panic attacks? Not like gently, how do we eliminate panic attacks? So that was the clients I worked with for a long time. And I felt really good during those years. I had like a little bit of dizziness, some weird symptoms would come up, but it wasn't until 2020 when I got COVID, I had a mold exposure in my apartment, and I started engaging in a mold detox through a provider that I really trust and still to this day trust, that I started getting horrific symptoms. And this was looking like I would get an IV for the mold to help with like, the immune response, glutathione, all these things. And I would leave and have a fever for 6 days and be sick with like severe, what I would call like physiological anxiety, which I had not had a panic attack or anxiety in however many years. It wasn't even a thought in my head anxiety anymore. And this was very physical for me. It wasn't in my head, shaking violently. And then I went in this time, I also went to get a chiropractic adjustment. And I left that chiropractic adjustment. They had loosened a lot. They had like taken this metal tool, and chiropractors listening will know what that tool is.
Yeah.
It looks like a scalpel kind of, and dug it into my neck.
Like a scraper or whatever.
Yeah. Exactly. Yep. I walked out of that appointment and was on the floor outside of the building because my heart rate was 160 sitting from the manipulations that happened in my neck. I crawled to the ER. I was on the phone with my sister. I put her in my headphones and I said, I'm on cement and I'm crawling to the ER right now. That's where I started to understand this picture of there was like this weird connection between my neck and my heart rate. Maybe there was something going on with this immune response, and that level of sickness where I couldn't walk for months. I had insomnia that was so severe, gut issues. This was a different level of sickness I had never seen even in my clients before. And that's what led me to really understanding the root cause of mast cell activation syndrome, POTS, and hypermobility. And it was that journey and clawing my way back to health that led me to the second leg of my career, which is helping this population of people I call those living in highly sensitive bodies.
Yeah, that sounds somewhat familiar. I think I was talking a little bit before about some different people in my family that not necessarily all the details, but definitely some of the, the hypersensitive bodies. I like how you put that, because that's literally word for word like what my wife will say, and referring to a few other family members that we have, where it's just like everything they do or take, the hey, 1% of people get this side effect. They're like, we're the 1%.
We're the 1%. And then we also get these side effects that no one on God's green earth would ever think someone could get from these on top of that. Absolutely. Yes. Exactly.
Well, I wonder, just for those who maybe haven't heard of these things before, if you can, mast cell activation, POTS, kind of high level, just could you walk us through what does that mean?
Yes.
How does one know if they have it? What, all that good stuff.
Yeah. So everyone will see online now, you're going to see the word histamine everywhere you look, especially after you listen to this podcast, because the algorithm is going to start attacking you with histamines, by the way. But when we talk about histamines, the context that we usually think of them is, seasonal allergies, you take an antihistamine. Histamines are a compound released by our mast cells. So mast cells are a form of or white blood cells. They're part of our immune system, and their goal is to really detect threats and respond to threats in the environment. Very unfortunately, when COVID happened, COVID and these mast cells have a direct relationship. And this is what I think exacerbated so many people having so many odd and excruciating symptoms in the past 5 years, even though mast cell activation syndrome, of course, existed and occurred in people before then. So our mast cells have receptors on the outside, and then they have sacs on the inside where they can degranulate and basically the chemicals inside will be released as chemical messengers to tell the body, what do I do in a time of threat, essentially. One of those 1,200 different chemical messengers is histamine. So in the case of COVID, for instance, COVID virus attaches to and attacks the ACE2 receptors on the outside of the mast cell, and the body keeps pumping out these messengers. Normally, we need these messengers for repair, to get nutrients to the site of injury, to get immune particles to the site of injury, immune cells. But when you have too many of these particles floating around, the symptoms can be disastrous. And the reason we talk about histamines more versus the other 1,200 chemical mediators is because they tend to cause pretty extreme symptoms. Like one of the most important things that histamines do is they cause something called vasodilation, which I know many listeners will know what that is, but I'll just, reiterate, is the widening of our blood vessels, right? So when our blood vessels are open, great. It actually creates like almost like a slide in the body. So if you need immune cells, immune particles, nutrients, anything to get to a site of injury, great. The blood vessels are wide open. Everything can get there really quickly. But what happens when your blood vessels stay wide open repeatedly because histamines are constantly signaling for them to stay open? Well, it can look like something like this. And I give the example of someone who's standing in a shower and instantly they feel really dizzy and they look down and they see that their legs are red in the shower. And then they notice their heart starts to pound. So heat is also a vasodilator. And if someone with histamine issues, what can happen is you have these blood vessels that are wide open. The heat makes it even worse. Blood pools down in our legs. That's why our legs get red. It's literally blood like at the surface pooling. And then our heart and our brain go, hello, we need blood flow up here. So your heart starts pounding really fast to get blood flow back up. And that's why we get that really uncomfortable dizziness symptom because of even the tiniest change in blood flow can cause that. That's that experience basically. And that's what people can experience every day with histamine issues. It doesn't only have to be in the shower. And that's one role of histamines that can cause one symptom. Histamines can cause probably hundreds of symptoms. So what's happened is these really benign activities like showering and doing things can cause these insanely huge symptoms. And I think that's why we've been talking about MCAS so much recently. This constant activation of these mast cells, mast cell activation syndrome, is because the symptoms are so extreme and so scary. And in the case of POTS, and I think we can either go into POTS now or we can like go in later if you want to do more of MCAS, but I can just briefly define what POTS is.
Yeah.
POTS is postural orthostatic tachycardia syndrome, which literally means you make a postural change and your heart rate goes up. POTS is a form of dysautonomia, which is really confusing because if I had a racing heart, I would go to a cardiologist, right? I would not go to a neurologist. Dysautonomia means dysfunction of our autonomic nervous system. So that means that your brain is not sending the signal to your heart or your muscles or any part of you to pump blood to the correct area, essentially. So it's actually your brain and your nervous system says to your body, how do I pump this blood? Where do I send this thing? And that is why POTS, again, is a condition of the nervous system, which is very confusing. And something that I'm sure we'll go into more, but there's this relationship between POTS and MCAS in the nervous system. And also in this, I think this vasodilation feature is really critical to connect them as well.
Yeah, no, that's when you say it and you walk through the mechanisms there, it makes total sense because I'm thinking of both. And I actually, a good friend of ours, two friends actually suffer from POTS, but I never like wrap my arms fully around what you just described, but you just connected the dots to, I'm like, that makes total sense. Like I just never really connected the dots on what was going on. I knew when they changed their posture that would happen. But the mechanism as to why, like I said, I just didn't dive into it, but that makes complete sense on how it's neurological when you walk through that. And I think it's, I'm curious too, if we go back to, the mast cell activation syndrome, is that something that is commonly diagnosed? Is that hard for practitioners to identify that? I don't hear it as much, like I haven't heard it a lot. I'm just curious, but I do hear those symptoms a lot.
Yeah, it's challenging to diagnose. There's a couple different ways we can do it. Also, what makes it, and I'll talk about the actual diagnostic capacity, but the really interesting thing about histamines is their symptoms do not align with their system of origin. So again, Joe, if your heart is pounding out of your chest, are you walking to a immunologist's office? Are you like, I'm going to the allergist, my heart rate's 160? The way our healthcare system is fragmented especially in conventional medicine, allopathic medicine, is it's very fragmented by body part and organ system. So the problem is you'll go to the doctor where the symptoms are from, but that doctor can't explain what's going on with you, essentially. And that's what's so frustrating. You're never going to go to an allergist or a neurologist for your heart pounding. It just doesn't make sense. So there are some interventional cardiologists who treat POTS, but not MCAS. And that's what's really, again, the symptoms are so extreme, right? If you had flushing all over your body, I don't, it depends on where you would go. If that flushing is from POTS, you need a neurologist. If it's from MCAS, you need an immunologist. So that's what makes it so challenging, is by the time people get to the doctor's office, they're in the wrong doctor's office anyway. And it's not the doctor's fault. Honestly, they just don't treat those conditions because it's not their origin. MCAS can be diagnosed through urine measurements, serum measurements. So basically what you do is you just try to measure those mediators. How much is hanging out in your serum? How much histamine is hanging out in your serum? How much is hanging out in your urine? The problem is, and why it's not so specific or accurate, is because histamine doesn't live there. Our mast cells live in our connective tissue. Histamine will go, to the site of injury from their organ of origin, but they don't live in the bloodstream and they don't live in the urine that much. So oftentimes people won't catch it. The other thing is, when you're getting a urine test or a blood test, you have to go during a flare, because remember, it's not like every day the histamines are just there. It's in response. So people aren't often able to even physically feel well enough to get that blood test done that exact right day, right? There is a better way to do it, but it's a little more challenging, which is you can biopsy the inside of your gut lining. So if someone's getting an endoscopy or colonoscopy, I'm like, tell them to biopsy for mast cells while they're in there. You can biopsy the skin, but it's invasive and uncomfortable and not something that's practically done very often. So that is more accurate and considered the gold standard, but it's not generally done in practice that much, but it can be. And I've seen diagnosis in that way. When it comes to POTS, it's usually diagnosed through something called a tilt table test. They will lay you down, change your posture, measure the heart rate changes, essentially. So it's not telling you what type of POTS you have necessarily, but that is the diagnostic test, is to literally see, does your heart rate change with postural changes?
And are there things that, a couple of questions to follow up to that. And I know some of it is painting with a broad brush here, but it's just kind of generally looking at it. When someone, what could potentially lead to somebody who is likely to have a flare up of just too high of histamines? Is it activity or food related, environmental, or all the above? What does that look like?
Yeah, we view histamines the same way we kind of view other autoimmune diseases or chronic illness. It's kind of the bucket theory, right? You basically have too many impetuses and too many triggers that eventually the bucket gets overfilled. Your mast cells start freaking out, essentially. There's a really tricky part of mast cell activation syndrome, and I will talk about those specific triggers as well. But I kind of view our mast cells as the guards on the watchtower of the body, right? So let's say they're looking down at the battlefield as something's happening. Our mast cells not only are going to help to clean up the debris after the battle, help move the bodies terribly, but they also are going to then be constantly thinking, well, that can never happen again. That immune battle can never happen again. That was so scary. So then if someone has a symptom, there's a lot of false alarms where it's oh my gosh, is the battle about to happen again? Let me start deploying all of these chemical messengers. So the problem with mast cell activation syndrome is that it is a problem unto itself, because we become so afraid of symptoms that we end up activating the mast cells again, because they can be activated through nervous system and our limbic system. So it's really frustrating, that part of it as well, because the more scared you are of your own body, the more the symptoms come. And it's a very tangible relationship. It's not like this hypochondriac thing. It's very literal. The triggers things that can trigger mast cells is heat changes, too cold or too hot of temperatures, anything that triggers, again, a need for higher autonomic control. Environmental toxicants, definitely mold. Certainly if someone has nutrient deficiencies, that can trigger a threat response in the body. Gut dysbiosis, very common mast cell trigger. Stress, trauma, absolutely. And then anything that is literally, if you're eating something high in histamines, that can also trigger the body to produce more histamines. A very backwards thing that our body does. The more histamines we have, the more we produce, which is very odd. And the problem with that is that the foods that are high in histamines are the healthiest foods in the entire world. We're talking about, if you went to a gut health doctor, they would list you all right, you have to have fermented foods, citrus fruits, vinegar, these bone broth. These are the healthiest foods ever. They just happen to be high in histamine. So that can trigger someone. Alcohol can definitely trigger someone. And really anything that is, again, excessive stress in the body, that can be exercise, that can be sauna. What I've noticed as the biggest trigger to histamine issues is actually functional medicine interventions, which is a really frustrating thing, because you can have a root cause like a mold issue, right? So in my case, we were doing binders, we were doing TUDCA, but the act of detoxification is incredibly stressful on the body.
Yeah.
And if you don't have proper drainage, you have toxins floating around your bloodstream getting recirculated, and the body then mounts an immune response on those. So I see, I'm such a lover of functional medicine and functional nutrition. Back in the day, conventional medicine was like, when conventional medicine failed you, you would go to a functional medicine doctor. And it was like, this is where you come. When conventional medicine fails you, we will find it. The only clients I see now are those who functional medicine has failed. And it's not functional medicine doctors' fault. It's just, it's a different climate than we've ever seen before, because the body is not, you can't just do a mold detox and get a little Herx reaction and get over it. The Herx reaction with histamine issues is you're getting sicker. You have to stop. So you really have to work on the histamine issues first before going forward with the rest of it. And it makes it really tactically challenging for sure, but doable, of course.
Sure. I got about 7 follow-up questions. So my brain is keeping up. This is awesome. This is great. Okay, so I'm going to go way out on I have no clue on this topic. So that's my disclaimer if I ask a dumb question.
Yeah. So, I've never been on podcasts where any functional medicine doc really does. It's like we're all catching up. Everyone's doing the best they can. So go, please.
Yeah. Well, I'm curious to so does it work similar? Because you mentioned a couple triggers. Does it work similar? Is there a relationship there? And I'll give you an example, but with an allergic reaction, because I know my wife, for example, never had an issue with bee stings, drove over a hive with the lawnmower and got stung like 25 times. It was brutal. Almost went to anaphylactics, whatever. Everything was fine, but now it's like, if she ever gets stung again, that's the concern, is the body's response. Is that a different mechanism, or is that kind of similar to what you're describing? Would that be?
It's mediated by different compounds, obviously, versus antibodies or otherwise, but a little bit. There's some truth to the immune system and the nervous system working together to amplify the response in case and protect you, to make sure that, because obviously an allergic reaction as well, it's the immune system is saving your life. It's just causing other symptoms on top of it too. So yes, I do see that with histamine responses, because that it's partially histamine mediated, but also like antibody mediated, right? So yeah, I would say that it can happen where people have smaller responses and one day they can tolerate it. It doesn't build necessarily in a histamine response, but it can definitely get worse as time goes on, as the body mounts a stronger response, or an anticipatory response. A little bit different, but the premise is there for sure. Yeah. Okay. Yeah. And
another question that I was thinking when you were describing that, so you mentioned something related to like dramatic events. Is that both or one or the other? Like, would it be psychological, or is it a actual like physical damage that caused the histamines to,
both.
overreact? Both.
Yeah, okay. The other chemical mediators that are released are familiar ones, like cytokines, prostaglandins. So a lot of those are released due to physical trauma or injury as well. And then the memory of that physical trauma is a mental trauma too. So there's a couple different components, but mental, emotional trauma is just as impactful as physical trauma, and both of them can cause a histamine response for different reasons. It's anything that employs the nervous system or the immune system to a strong degree is going to cause that reaction in people who the body decides to go in that pathway, essentially. Because not everyone, of course, doesn't have a histamine issue. Yeah.
Okay. And the other question, and I might be opening a whole can of worms here, but that's fine. As far as like women in their cycle, some, I'm theorizing here, and maybe I'm right, but some of them have these adverse reactions where it almost seems like low progesterone, too high of estrogen during a certain time period.
Yes.
And so I'm wondering how histamine interplays with that, and or if someone's already more sensitive to the mast cell activation syndrome, and then they also have a little bit of a variant between where it should be, like progesterone, estrogen. Would their symptoms be that much just more aggressive? Because I'm just kind of based on what you're describing.
Now, Are you, then now I have to ask you a question. Are you asking this because you've literally seen this in practice, or is it something that you kind of know in the back of your head because you know about the mechanism? I need to know if you're cheating or not, because if you actually found this out because you love the woman in your life so much, I will be so proud of you. Either way, I'll be proud of you for this mechanism between estrogen and histamine, but I have to know. Is this something where you kind of know the mechanism, or it's literally you've noticed this?
I would say it's a definitely noticed it. And a mixture of the second one, I can't give myself full credit. It's more of like just connecting the dots with my OCD brain.
Exactly. Yeah, that's awesome. I just had to give you credit where it was due, because very few people make that connection. So I'll give you a funny story for myself, but every day on like day 7, day 9 of my cycle, I would feel so ill. And I basically would write into Reddit, because this was like pre-ChatGPT even.
Yeah.
I'd write into Reddit like, why dizzy day 9 cycle? It doesn't, there's no answer in a textbook that's going to tell you why you feel weird when your period ends, right? So it took so much for me to pull these pieces together. And what I really noticed is those with histamine issues actually feel worse, opposite of when non-highly sensitive people feel bad. So most people, if you look online, every woman's like the luteal phase. Most histamine clients feel great during their luteal phase, honestly. They actually feel worse because there's a direct relationship, exactly like you said, between estrogen and histamine. So as estrogen rises, histamine gets released. As histamine gets released, estrogen rises. So because of that close relationship, people will have their worst symptoms the day their cycle ends, like the day they stop bleeding, up until ovulation, peaking at ovulation when estrogen is highest. Then they'll usually get some reprieve. And then there's another estrogen spike in the second half of our cycle. Usually on a 28-day cycle, it's days 19 to 21. They might notice a pickup in those symptoms. So it's like so hard to, why is it when I stop bleeding, then I feel so, I'm supposed to feel better. This is supposed to be when I'm supposed to feel powerful, ovulation, like I'm supposed to feel strong. This is when I'm supposed to lift. But for these highly sensitive clients, that estrogen histamine relationship can be so symptom causing and driving.
And as you mentioned this earlier too, is there, let me think of how to phrase this, but so when I look at hormone methylation and like the pathways to clearing the metabolites of these hormones, I guess two-part question. Is it similar how histamine's cleared? And when you were mentioning earlier, it getting kind of these backed up or staying in the system, is it what's the pathway? Is it a methylation issue? Is it like, how does the body clear it, and what could be the issue?
There's different enzymes in the liver and the gut that clear histamines. Mostly people will hear about the gut ones, which is the DAO enzyme that we, like everyone, like those supplements, the DAO supplements.
Yep.
That's where a lot of people will get gut-driven symptoms also, like when they're eating high histamine foods. Methylation issues can still affect histamine issues, because if you look at like our huge genetic picture, that if you have some sort of lack of issue in one area, obviously all detoxification can get slowed. And then again, you have that recirculation of toxins as well. So it's not a methylation thing directly with histamine issues, but because I know a lot of people like, I'm MTHFR, which I don't like when people talk about it as a diagnosis. It's not a diagnosis, it's just a SNP. And that's driving the histamine issues. Well, you can't just slam yourself with B vitamins, because that causes huge histamine reactions as well. So it is involved in a side layer, but I'm looking a lot at histamine breakdown in the gut as well.
Okay.
Yeah.
And is that something you've historically seen some success with testing that to see if that enzyme's high, low?
What we'll do is, it's pretty hard to test, but what you can do is just have people take it and see if they feel better. Honestly, that's what, I have a friend, Olivia Amatrano, who's on Instagram as Organic Olivia. She's an incredible herbalist. And she wrote this article a long time ago about, it was a magazine, and they said, tell us, what do you always carry with you when you travel? And she said, I carry Benadryl with me every time I travel, because it's like the major fix to everything in life. And I was like, you didn't know you had a histamine issue? I was like, just so you know, when people take Benadryl and they don't have histamine issues, it doesn't fix their lives. I'm like, if you have a histamine issue, you need to address basically the histamine issue. So if you take a DAO supplement, but you don't have a histamine issue, you're not going to feel better in any capacity. If you take an antihistamine and you don't feel any better, or if you feel worse, it might not be a histamine issue. So even though it takes a while to notice the effects of it, unfortunately, but that's a bit of a gold standard as well, as like, if you take a Pepcid and your entire life is better, there's something there, basically.
Wow.
Because if you
Sure.
take a Pepsid and you don't have histamine issues, you'll feel nothing at all.
Right. That makes sense. I wanted to go back to the anxiety tie into this.
Yes.
Can you walk through how, whether it's related to the timing of the cycle as well? I mean, I'm going to assume maybe because of estrogen when it goes up and histamine response. Can you kind of walk through how that works? I do sense that there's some people out there that perhaps are misdiagnosed or maybe misinterpreting what's going on, and it could be related to what you talk about in your content, but I don't want to butcher it, so I'll let you take the reins.
100%. Yeah, no, 100%. Histamines also are very arousing and alarming. That is their goal. Like, again, old school functional medicine, we used to always talk about like cortisol. Your cortisol is too high. Your cortisol is too high. Histamine is like a pretty direct relationship with histamine. It's like if your histamine is high, yes, you will feel more anxious and more alert. The experience of anxiety with histamine is very physiological. It's heart pounding. It's ants crawling under your skin kind of feeling. It's I'm wide awake. And again, I have a client story to share about this, but I had a client who had severe untreated insomnia, and it was because untreatable insomnia. She herself is a psychologist, actually, and an incredible one at that. And she would just be awake, like eyes wide open, awake all night. She had trialed 8 psychiatric medications, some taken at the same time, some taken at different times, Ambien, Trazodone, Klonopin, anything, and just nothing made an impact. These medications that always make an impact, for her, they just didn't. She was sleeping, it was like 21 days straight. The most sleep she got was like 2 or 3 hours any night. And it's turned into like paranoia. That level of anxiety was so extreme for her. And I had read a study about, this was a really long time ago. This client was like 5 years ago as well. And I had read a study about long COVID and Pepsid. And I was like, why would they use an acid blocking drug for long COVID? I couldn't understand what that was. And then I started to understand that, Pepsid is actually an antihistamine as well, even though we view it for its acid blocking capacity. So I had this client trial Pepsid. I said, let's just see if it's a histamine issue. Try Pepsid. And she slept well that night. She's been sleeping well for 5 years. She never had a sleep issue after that. So if it is driven by histamines and histamines are making you awake and alert, you can't you have to address the direct reason, because if you just try to calm your body down, but that fire alarm in your body is going off, your body's like, you're not listening to me. I still need you to address this issue. So definitely during the cycle, again, women can feel more insomnia, more anxiety, and more of that aroused in a negative way, like overly stimulated experience that then translates into the mental anxiety during those high estrogen times.
Okay, great. No, and to set up my next question, I want to ask a clarifying question too. Does it generally, histamine, call it issues, just generalizing, does it happen more in women than men? Is there?
They do. I mean, as all immune and autoimmune conditions do, yes, they do. But I have to say, we treat not equal amounts of men and women in my practice, but yeah, we have a lot of men who have histamine issues as well. But yes, because of those hormone fluctuations, because of the nervous system changes, and because, again, it's like women operate on like a 30-day cycle, men operate on more of a 24-hour cycle. Yes, it's definitely more common. And again, the nervous system piece, unfortunately, the cortisol piece and all of that as well. And I think we might encounter in sometimes more emotional trauma and things like that.
No, it makes sense. And then is there any practical ways, let's say someone feels they have this is related to histamine. Is there something like, I'm feeling panicky, my heart rate's going up a little bit, outside of, let's just assume that, cardiovascular, they're good. We certainly don't want to tell anybody, don't go to the ER if you think you're having a heart attack or anything like that.
Exactly, yeah.
But is there any other like tools or things one can do and instantly, or is it more like they have to address it over a period of time?
Yeah, no. If you have histamine issues and you believe that they're driving your anxiety, you can do things at home. Absolutely. The only problem is every single person reacts differently to medications and supplements, especially our crew, the highly sensitive body crew. They react differently to everything. So I would say, through probably the guidance of a medical doctor or dietitian, Yeah, you can trial things like nettle leaf tea, even like there's really gentle versions of things, all the way up to supplements, all the way up to medications. But if you know there's like a high histamine, estrogen driven day in your cycle, I'm like to my clients, like, it's not a banana day. It's not a vinegar day. It's not a bone broth day. Like, I might just say, let's take it down a little bit. Maybe we do take a little extra Dow. Maybe we drink a little extra nettle leaf tea. But that's where I would identify stress triggers, environmental triggers, food triggers. And I would just try to reduce your histamine load as much as possible. And then I would focus on things that, help with your a robust immune response in the future that can help you. But in the interim, just try not to accumulate histamines or help with supplementation or medications with, again, under the guidance of your doctor or with your own self experimentation that's safe, to lower the histamine load during those times.
No, that makes a lot of sense. I mean, especially as you mentioned, like the food part, right? Because, you know, just being mindful of that. And I think that's where definitely there's a lot of application there, but the nutrition and timing and what you're doing and where you are. I mean, guys, you know, we're a little easier, right?
Yeah.
we're, you know, because every day it's rinse, repeat, like, but for women, you know, just to kind of, I think that's a big thing in women's health, and I'm a guy, so I'll say that before anyone hammers me in the comment section. But just what I hear from a lot of experts in the field, you know, you being one of them too, is like just really being in tune with your cycle, with
Exactly.
you know, taking those tracking, knowing what am I feeling, when am I feeling, so when you have a conversation with someone like yourself, you can best equip them to help come up with a strategy to, you know, remove a lot of these issues or help mitigate against them.
Yeah, 100%. I mean, I would say cycle tracking for me was the most life-saving experience I had, because that's where I even, again, landed on Reddit. Why I feel bad, day 9 cycle, what's going on? And I basically would have a migraine on day 21 of my cycle every month. And when I would have a migraine, and then I would look back at my cycle tracking and see, oh my gosh, you had a migraine every month for the past 3 months at that same time. The feeling of relief that washes over you, knowing, okay, this is predictable. I understand my body, and my body's sending me signals I can anticipate and take action towards. That this is one of the rarest syndromes or conditions in the body where knowledge is healing. Like, literally, just knowing that can make your nervous system calm down so much that then you don't have those symptoms again, because these are nervous system driven syndromes, unfortunately, which is, again, the most unfortunate part of them, I think, is that they're nervous system driven.
Yeah, no, that makes a lot of sense. I want to pull up one of your diagrams in a minute here from Instagram, just to kind of talk through it for the viewers. But I did want to ask, revisit something you brought up earlier. You're talking, so in one of your posts, you're talking about, you know, people with histamine issues, problem is often opposite the excess vasodilations. You're talking about in regards to cardiologists. This can lead to symptoms like low blood pressure, flushing, dizziness, headache, and even anxiety due to increased permeability and blood pooling.
Mm-hmm.
Is there any relation, so with that and other things one would associate with low blood pressure, dizziness, lightheaded, for example, like not eating for 12 hours, 14 hours, is that like, how does that relationship play with histamine and or some of these, you know, symptoms that one may be, because I think a lot of people think it's low blood sugar in those scenarios, which is reasonable, or it could be part of the equation.
It is part of it.
Yeah,
it is.
Yeah.
Nothing is scarier to a body that's constantly assessing for threats and overreacting to threats than feeling like it's starving.
Sure.
So low blood sugar is a major nervous system trigger, major mast cell trigger, and major POTS trigger. Absolutely. It's a huge issue. Here's the problem. And this is this is reality. You could have a lot of nausea with mast cell issues and with POTS. You could have a lot of difficulty standing up, and food preparation is very challenging if you can't stand for long periods of time. Remember, in our example of someone in the shower with constant vasodilation issues, standing in one place is one of the most physically demanding and challenging things you can do when you have POTS. So food preparation can be so hard. So that's actually why people with POTS end up not eating for long periods of time. And then if you have really severe digestive issues, why would you want to, right? It's like, oh my gosh, I don't even want to put something in my stomach. So it's definitely really important for people to eat regularly. I'm so against intermittent fasting for this population. I know that, like, obviously the conversation around intermittent fasting is like, oh, helps detox or cellular detox, autophagy, all these things. But like, You can't even get close to that if your body's reacting before that even happens. You'll never be able to get close to that. So eating regularly and eating protein and carbs regularly specifically is so essential. Also in those with POTS, and there's a kind of, again, third part of my triad, which is this hypermobility component. They can get blood pooling in their gut when they eat large meals. And then if your blood is pooling in your gut, people feel like really dizzy and weird and lightheaded after a meal. So that can also make eating really unpleasant. And that's why people want to eat just one meal, get it over with, and not eat again. Something I want to bring up regarding that's really important is the conventional treatment for POTS is, like, doctors will tell you 10 grams of salt per day. Okay, 10 grams of sodium per day. That's 10 element packets, LMNT, those packets. People are freaking out when I ask them to drink one, right? That is a tremendous amount of salt. The reason is the hope is to increase blood volume. When you add sodium to water, right, it would increase your blood volume. The other treatment for POTS is what I call like making your body a Go-Gurt tube, essentially. So you wear compression socks and you wear a binder around your abdomen and you squeeze your body, and then the blood will push up, essentially. So if your brain can't make the blood flow, you just force the mechanism in the body, essentially. So people who feel this dizziness, lightheadedness, low blood sugar sensation, even when they're eating, I actually just have them wear a little abdominal binder, and then it'll push the blood flow back up, because when you're digesting, your body will pull blood into the abdomen with the for the effort of digestion, oxygenation, and everything like that.
Oh, it makes a lot of sense. And is part of, because you mentioned earlier gut health a little bit, and digestion, is that sometimes part of a tool you use as well to assess gut health and look at improving digestion? Because perhaps the reason why blood pooling is maybe the food's not being digested as effectively, or maybe there's some, you mentioned dysbiosis earlier. So I was just curious if that's part of sometimes.
Oh, absolutely. Gut health is a huge piece of the work that we do. Absolutely. And then gut symptoms is also a big piece of the work. So it's really hard. Like, let's say you have a parasite. You can't just go ahead and try to kill the parasite in a body with an over expansive immune response. Like, it's not an under immune response. It's an hyper immune response. So you can't really like instigate an immune response that much. So while we can look at the root causes of dysbiosis, we have to approach them very gently. And often a lot of symptoms that come from those with MCAS and POTS is from this mechanism issue of just too much contraction or too little food sitting there. SIBO is very concurrent with these conditions as well. And then the dysbiosis itself, again, will instigate an immune response onto those bad particles, whatever it is.
That makes a lot of sense. I had a friend that had SIBO and then had POTS, and then as they started to treat the SIBO and some other things, just I haven't heard of any issues or any act ups or anything like that after that. That's really interesting. That was quite a while ago. So I don't think I, even knew anything at the time about gut health much. And so it was kind of interesting to hear that scenario. I did a couple things kind of still processing here, but I did have a thought on, I'm curious with men that you, in your practice, you see with histamine issues, and it's more of, like I said, a curiosity where, like, I noticed some men, they could use like a low dose tadalafil or Cialis, like a vasodilator for health benefits. Obviously you can use it for sexual wellness, erection quality, etc. But there's some guys that when they get over like 10 milligrams, most generally practitioners are like a 20 milligrams, kind of like a standard dosing. They get like these massive headaches and issues. I'm just wondering, is that potentially related to some of the histamine issues because they already have vasodilation is too high in their body, or what is
100%.
Okay.
I almost cried when I was on Dr. Gabrielle Lyons' podcast. I almost cried when she mentioned headaches, because I'm like, I can't believe I didn't mention it. Yeah, this is my most favorite thing to talk about with histamines. So, okay. We know that when conventionally, if people have migraines, practitioners will recommend. I'm so excited I can barely speak. It's so funny. I get so crazy about this. I'm so glad you brought up specifically headaches as it comes to vasodilation. So when we think of migraine medications, or we think of what do people do with migraines, you look on TikTok, people will say, go to McDonald's, get a salty fry and a Diet Coke, right? Mm-hmm. When you think about what helps a migraine, Excedrin migraine has caffeine in it. Caffeine often helps migraine. Every single thing that helps migraines and migraine medications are mostly, not all, but mostly vasoconstrictive medications. Mm-hmm. So vasodilation is a known massive trigger for migraines. And that is because either, again, it could be one of two things. And this is something that is challenging, but the blood pooling in the brain because of the vasodilation can actually cause like pressure from the actual blood pooling. And then also the lack of blood pumping, the lack of vasoconstriction can actually cause the same symptoms. So if you look at most migraine medications, they are vasoconstriction medications. We know that people always treat migraines with Excedrin, which also has Excedrin migraine, which has caffeine in it as well. So certainly excessive vasodilation can lead to migraines. That is something that's known. It's not the only root cause of migraines. Of course, there's many root causes and we're still uncovering them to date. But if someone does have a vasodilation issue, and that could be a nervous system issue or a histamine issue, then certainly these medications would drive migraines. And in that case, if they still need the medication for whatever they're actually intending to use it for, that's where maybe something like a compression socks, maybe something like upping the sodium to keep the blood pressure up and the blood pumping and constricting properly could really help.
Yeah. No, and I think one of the things I see a lot in, and I don't want to go too far off on a tangent here, but so feel free to reel me in. But with athletes as well, I see is a lot of these similar symptoms, and this isn't maybe directly tied to the topic of histamine, but they don't even know how much sodium they get a day, and they eat pretty clean, and they a lot of home cooking where they're not salting their meals because they just heard like salt's bad, and I'm like, well, again, I'm just making an assumption. I'm like, but I'm gonna go ahead and guess your blood volume is like extremely low, 100%. And you just lost. There's some pretty people much. Yeah, like if you Google the Galpin equation, like Dr. Andy Galpin made an equation between like sodium and water based on your weight and how long you're in this much heat and blah, blah, blah. So people much smarter than me have these equations, and I just plug it in. I'm like, you need like I had a world champion jiu-jitsu athlete that was training in a gi for 2.5 hours, and then was eating an apple after because it was healthy. And I'm not making fun of him. Like, he's brilliant, smart guy. Just nutrition's not his expertise, and I'm like, no, like you need like a bowl of salt. Like, you're being a little.
Do you mind pouring salt all over that apple, sir?
Yeah, let's like put something sticky on it and just like roll it in it. Yeah. So I just find, I think I'm really glad you unpacked that a lot deeper, like the vasodilation and restriction and kind of the interplay on headaches with that. Cause I think that's often overlooked. And that's really something too that you said there, because how many people out there, and Starbucks is going to want to shut us down for saying this, but they're rushing to get their Starbucks because they have a headache, but it's really just the, low
blood pressure, something like that. 100%. Right. You just need salty water or something like that instead. Exactly. Yeah. Or again, when the nervous system is more dysregulated, the mechanism of should I vasodilate or vasoconstrict, which we also know can go the other way with like heart attacks and high blood pressure and all these things. We know stress directly affects the brain's, should I squeeze or release? What do I do?
Yeah.
It directly. If we know it in that direction. And it's funny, at one point I went to a cardiologist for POTS who was not familiar with POTS, but was like a friend of a friend. And the doctor said, oh, you should take nitric oxide supplements because they help with like longevity and they'll help with your heart. They're the most potent vasodilators. Yes. I mean, I would have been in the hospital the next day if I took them. And I was like, okay, I'm not taking this advice. But that's the problem, is the longevity space. It's always about pro vasodilation, because we know that excessive vasoconstriction is extremely dangerous. And this is well documented, and heart disease is a huge issue and high blood pressure is a huge issue. So it's, again, we have this paradoxical body reaction that we have to be conscious of as well. Because if someone also has high blood pressure, and there's actually a form of POTS called hyperadrenergic POTS, the main type of POTS that people will get diagnosed with is something called hypovolemic POTS, which is exactly what you're talking about, low blood volume. Sure. Hyperadrenergic POTS is literally your body has an adrenaline response. So they don't have low blood pressure and low heart rate that turns into high heart rate. They have high blood pressure and high heart rate. So you can't treat people with hyperadrenergic POTS and just say, have a bunch of salt, because that is also going to create potentially worse issues for them when they have that adrenaline response as well.
No, it makes a lot of sense. I did want to go back to a topic earlier, if we could, just because I think it's a really good visual for the viewers out there, and maybe you could walk us through it. Let me just pull this up here. So I had this post in mind just to kind of So I think this, just for those out there too, if you're listening on audio, check out Michelle Shapiro. Again, it'll all be in the show notes. You can go to her Instagram to see this diagram, posted on July 22nd. But yeah, I was wondering if you can kind of just describe this, just kind of high level. And you were bringing up hypermobility earlier, and maybe it's a good time to kind of introduce what that is.
Absolutely. Yeah. So when I'm talking about hypermobility, I'm talking about a cluster of potentially genetic, but not actually in the case of hypermobile Ehlers-Danlos syndrome, of genetic syndromes called Ehlers-Danlos syndrome. Hypermobility is the only one that actually doesn't have genetic basis, but basically what it means is you have some level, if you have Ehlers-Danlos syndrome, you have some level of incapacity to build connective tissue. Connective tissue lines every joint, bone, and organ in your body. Connective tissue is also where mast cells live. So if you are hypermobile, for instance, and you hyperextend something, and when I mean hypermobile, you're because of this lack of connective tissue, you can hyperextend past the point of range of motion, which is like, I guess, healthy. I don't know what word to use. It's just past the normal range of motion, and that can cause an immune response because your body's like, why are you doing that? The other problem is that if you can't build connective tissue, and remember that muscle, fat cells, connective tissue, all of the tissue in our body, and fats, again, fat tissue, but is endocrine facing. So people think our muscle just sits there. People think our fat just sits there. No, it actually communicates through hormones with the rest of your body and chemical messengers. Our connective tissue is very much like that. That's where our mast cells live, right? So our mast cells communicate from an immune perspective and a nervous system perspective and an endocrine perspective through our connective tissue with the rest of the body. So if we detect a threat in our connective tissue, whether it's overuse through exercise, whether it's injury, that will send that immune response through the rest of the body. So that's the connection between through mast cells and hypermobility. Now, also, if you have there's actually one type of Ehlers-Danlos syndrome, which is incredibly important to diagnose if you suspect you're hypermobile or you suspect you have a connective tissue disorder called vascular Ehlers-Danlos syndrome. Because connective tissue lines our blood vessels, your blood vessels may become leaky or rupture. So for those with vascular Ehlers-Danlos syndrome, when I've been to a gynecologist before, I was talking to her about this in her patient population. And she said, I will not allow clients who have vascular Ehlers-Danlos syndrome to go through pregnancy because most of them die during pregnancy because of the expansion of the blood vessels, because that can create these leaky, unstructured blood vessels that can rupture essentially. And which is obviously do not pass go situation that could happen. So when I have clients who suspect they have connective tissue disorders or Ehlers-Danlos syndrome or hypermobility, I say you have to go get an echocardiogram. You must go get an echocardiogram to make sure the integrity of the blood vessels is there. Now, if you have leaky blood vessels and you have, a lack of structural integrity and your blood vessels are loosey-goosey, you can imagine your blood flow and the direction of your blood flow is going to be impacted. So that's where POTS and hypermobility are connected, is in that connective tissue and the integrity of the connective tissue and that piece. Long COVID, I never knew I was hypermobile before long COVID. I never had symptomatic hypermobility before long COVID. I never had pain in my joints. I never had dizziness like that. Nothing profound. And then when COVID happened, I started getting really bad body pain and symptoms. So long COVID, because it's activating the mast cells create an inflammatory cascade, which can also cause leaky blood vessels, leaky and like both gut impermeability and impermeability permeability of the blood vessels. That also then connects to POTS and Ehlers-Danlos syndrome as well. So you can become symptomatic. You can have hypermobile Ehlers-Danlos syndrome and never be symptomatic, but it can instigate the symptomology basically. And then all of these conditions, besides histamine tying them together, syndromes and conditions, are tied together by our nervous system, because our nervous system, again, will dictate where does blood flow go? What muscle do I use? What do I contract? So in the case of hypermobility, because of the brain connection between connective tissue and the nervous system, we often don't understand what muscles to use. So it's really funny. I have a hypermobility specific chiropractor trainer. I love chiropractors, by the way. I'm okay that chiropractor did not assess me for hypermobility. I wish everyone did, but I do not blame the chiropractor. He just didn't assess me for hypermobility. But my chiropractor, Taylor Goldberg, I will be doing a workout with her, and she's like, why are you stepping with that foot? I just told you not to step with that foot. Like, she knows how the hypermobile body works, but there's a little bit of a severance between the brain and the body. And this is where fitness and musculature comes in place. If we don't have the structural integrity to hold ourselves up, right? And that's why we're hypermobile, because we're not holding into place. Muscle is something that's something we can control. It's almost like muscle puts bricks in there to hold you up, right? We're like bobbleheads, and you put something here to hold you together. So muscle is so essential. And again, muscle has anti-inflammatory endocrine facing components. So where, our mast cells are really releasing many compounds, many of which are inflammatory compounds. Being in a histamine episode or a mast cell episode, it's a state of inflammation that it's very, you're talking about cytokines. So the amazing myokines released from muscles, the endocrine components of muscles is also so profoundly helpful with this population. So they're all tied together through connective tissue and our nervous system.
No, it's really helpful. Let me fix the screen here.
I know I went in the weeds a little bit, but
no, it's perfect. I'm trying to think of my question with some of this. So if someone's hypermobile, how does one know that's a label, if you will, that they should have? Or is it, because I heard you, well, let me first pause there. I guess I'll ask the first question.
Mm-hmm. So there's generalized joint hypermobility, which is not Ehlers-Danlos syndrome, and people can have, which is when like 5 or more, it's like an online thing you could even look at probably. I wouldn't recommend self-diagnosing ever.
Sure.
But like, do 5 of your joints move past the point of motion that they should? Ehlers-Danlos syndrome as a connective tissue, there's, I believe, 13 different types. 12 of them are diagnosed through genetic testing. Hypermobile Ehlers-Danlos syndrome is not. We have not found the exact genes yet, but there are so many studies about long COVID and its relationship to hypermobile Ehlers-Danlos syndrome, which is really cool, and a lot coming down the pipeline there. So it would be through assessment mostly. There's different questionnaires. There's different physical assessments that can be done, and that's my chiropractor did a physical assessment to determine that. I do have some genes that are interesting with that as well. And I also I've done like x-rays that were like in motion to determine that I had really profound upper cervical instability. And the reason that I left that chiropractor's office on my freaking knees crawling to the ER was because the joints in your neck, I mean the nerves in your neck, and we know this, we talk about the vagus nerve every second in functional medicine, control your heart rate. They control your heart rate. So when you are destabilizing, subluxating any of those nerves through affecting the joints, just think about how your nerve endings are on fire because they're being pressed against and unprotected. Yeah,
that was going to be my question. Was that I was going to circle back to the chiropractic incident, but that answers that. So I appreciate that.
Yeah.
What about relation to the diagram we just had up and any of those mechanisms relative to soreness? So if someone's more hypermobile or have a hyper response to histamine, would they be more sore than someone who doesn't? Yes. Like, is there an interplay there, and why?
Histamine plays with our pain receptors as well, by the way, so they can amplify sensations of pain. Hypermobility, you're going to have worse recovery, unfortunately, because of the connective tissue piece. And also, when you're working out and moving your joints past the appropriate range of motion, it creates pain in the body. And then also what really happens for most people is compensation. So you just move something out of place and your muscles are going to tighten to hold you together. It's like, oh, don't move. Wait, I need to help you. So we think that the muscle tightening, that's the pain we experience, is actually in the muscle tightening. But it's in response to the fact that you just potentially, you moved out of a range of motion, you utilized a muscle that wasn't appropriate. So people who are hypermobile, you must work out in a specific way that's sensitive to hypermobility, and you have to go so crazy slow. Like, I was frustrated when I first started with Taylor because I'm like, I don't want to lift these 5-pound dumbbells, but she's like, you don't know how to walk yet. Like, we have to make you you have to walk it all the way back because your body is not doing what you think your body's doing when it's moving, and you're not activating the appropriate muscle groups. So it's actually a lot of mental work also to be like, okay, focus. This goes first. This goes first. And those with hypermobility really want to move fast, and it's just more comfortable for us. Standing in the same place is like pain for us. We want to like move. We want to do things fast. We want to get through things, but it's really about slowing down and making sure that the appropriate muscles are being utilized and you're not moving past that range of motion to reduce pain.
Yeah, and you mentioned in there, just to add another note that I had that I wanted to have you unpack a little bit more. There's a tweet you have where basically it says, and I know you know this, but I'm saying this for the audio listeners, it says, secret weapon for weight loss, walking. Secret weapon for mental health, walking. Secret weapon for detox drainage, walking. Secret weapon for better sleep, walking. Secret weapon for balancing cortisol, walking. Can you walk through if there's any other layers to add to the importance of walking, the application of walking? How would you recommend one who doesn't walk at all or very low activity implements it? I guess just someone who's listening to kind of all the above, the benefits.
So funny. I'm always like embarrassed by those posts because they mean so much to me and they're so simplistic. And I think I can be really annoying and like highly cerebral. And I know you're like that too, Joe, where I'm like, I have to intellectualize everything in my own head. And then I'm like, I have to be honest, like I've been a dietitian for over 10 years. If you ask me what's the most important thing for your health, I would be like, throw your schooling out. It's walking. Like that is the most important thing in the entire world. A lot of what happens in POTS and a lot of what happens in MCAS is that we become incompatible and unadaptable to our environments. Mm-hmm. Walking forces your blood to act appropriately, right? It is a conditioning exercise that is so critical in these populations and so hard. I mean, I had to have my dad here to help me, like, because I was like, you got to just, my husband was at work and like that first week after that injury, I could not stand up. It was impossible for me. My heart rate would jump so high. I would fall down. It was a disaster. My neck muscles, I was in a neck brace for 6 months. And I said to my dad, I'm like, can you get me to the end of the hallway? Like, I don't know how I'm going to do this, but let's get to the end of the hallway. And now I walk my 10,000 steps a day joyously, like, no problem. But it's the conditioning aspect. And again, activating not only the muscle groups, the blood flow and reconditioning, but also like reconditioning to the environment. I can't even explain it. It's like, it's putting the body back in motion. It's just so essential. And this is something where with POTS, it's very uncomfortable to move. And there's actually a specific type of, it's a free PDF online called the Chop-Levine protocol designed for POTS specifically, conditioning exercises for POTS exclusively. But the more deconditioned you get, the less blood flow you have, appropriate blood flow you have, the less muscle you have. It gets really vicious from a cycle perspective. So sometimes walking is the best place to start. I started with crawling, I'm telling you, and then, you have to, it's just really slow process, but I just can't imagine, I couldn't promote anything harder than walking. Yeah. I think it saved my life. And I think it saved my clients' lives. Also for people who are struggling with weight loss, I'm like, it's a non-negotiable. If you're struggling with weight loss, it's just a non-negotiable.
It's kind of like a lot of the stuff that's out there that everyone's like, yeah, duh, you got all these people with these very high level PhDs and stuff. And they're talking about sunlight and walking and, and you're like, yeah, we know, but it's because no one's doing it. We're not doing it.
We're not even doing it all the time. Right. It's time consuming to walk 10,000 steps a day. You need 2 hours of walking. I mean, that's a lot of time for all of us busy people. Like it's a big deal, but it is contagious onto itself. I'm telling you, like if anyone asks me as a registered dietitian, what's your big tip? I'm like, go walk. Like if you can do it, please,
I just see a huge utility and I'll move on because I know it's not the most exciting topic for people, but two things like walking in the morning, walking after a meal, even though they talk about in the studies, like 10 minutes walking after a meal and the effects on blood sugar and nutrient absorption, digestion, et cetera. I'm like, do 2 minutes. I don't just do something and then we can build on it. Just build on,
exactly.
But
go take the trash out after you eat it. Yeah, whatever.
Yeah, and you put in here sleeping and walking, and I'm sure there's other utilities, but one that really simple when it comes to me is, okay, I can sit in my house, sit down, and have no sunlight, no whatever, and my cortisol doesn't know what time of day, or my body, I should say, doesn't know what time of day it is, whatever. But if I just go outside first thing and get moving, all the benefits talked about, but one relative to fixing that diurnal pattern, to know oh, we're awake now, we're moving, the sun's on me, as basic as it seems, I've noticed just in the last couple weeks, we've always done it separate. But my wife and I started doing it together a few weeks ago, and both of us we'll look at each other and be like that look, like I don't want to do it. She doesn't want to. Like even though we've been doing this our whole life.
Like, should we watch TV and not?
Yeah, it's like, yeah, I got work to do. I got this, but we're like, nope, let's do it. And then all of a sudden, you start like one says to the other, we'll say to each other like, oh, I'm feeling this today. I'm feeling that today. Like just feeling better, overall.
You have to like get moving. I know I got my, it does sound so silly, but I like got my husband walking with me too. Obviously he's walking, but I'm like, I got him to go on these walks too. And it makes such a profound difference. I know it sounds silly, but I think it is, especially for these specific clusters of conditions, it is so non-negotiable, and you have to start where you're at, right? I get comments all the time. What if I can only walk 1,000 steps? Okay, walk 1,005. I mean, it's completely subjective to what that looks like, but it was definitely the thing that I think got me out of the worst pain and symptoms of my life. I really, really believe that.
I would like to, before I bring up the next topic, I would like to formally apologize to all my clients when I was in my early 20s as a snot-nosed young punk saying, no, walking doesn't count for your exercise. Like, you got to get your cardio in. And I, of course, I softened up over time, but, especially I think of that. And I think of like when I'd have kids in sports, I'm like, what do you mean? What do you mean? Like, you can't make it to the gym? Like, just make it happen. And it's like now, doing this professionally, literally since I can remember.
Dude. Yeah, of course.
Yeah. It's like now having kids and travel sports and this and that. I'm just like, oh, I blinked and 3 days went by and I didn't get a good workout in. I tried to be active and do some things, but it's like I haven't trained, to where I would have like kicked my butt when I was 20, it would have been all over me. And it's just because it's your reference on life at the time. You're learning how to do those things.
It's actually a very interesting point you bring up, and something I think about a lot is that a lot of like functional medicine doctors are now in the space of like optimizing people's health. I've never worked in the space of optimizing people's health. I work with like, you come to me when we can't walk, then like, and I don't mean that literally, like I'm not a therapist or something like that, but I mean like, I want people who are trying to go from -100 to 0. That is my population. That's my client population. I always say like the people who are just like, oh yeah, like I'm going to wake up, do morning routine, go lift weights. Like I can't even understand what they're talking about. I'm like, my clients don't know. It takes us 30 minutes to like see if we're alive in the morning. Like that's not my people. So a lot of my Instagram information is really targeted at people who are sick, because like that's who I'm going to help. And that's a very interesting thing. But you learn as your body becomes like not a 20-year-old guy's body, like you're like, oh yeah, like I'm like different now. My advice is different now. I get things in a different way. I've just had the fortune of being super sick many times in my life that I'm like, oh, I've always been a 90-year-old. I couldn't even imagine like people just like, get to the gym. I'm like, these people can't get to the bathroom. Like that's my crew, but it's the joy of my life because I get it. I appreciate and understand the mindset of being physically hopeless. And that is my honestly favorite people to work with.
I think it's a great point because we do in a lot of our marketing, we talk about optimization and things, but it really truly is more, I would frame it as, and we probably could come up with some different ways to present it, but I would frame it more as like optimizing you from where you are today to where you could be. Like, just like I was saying, you mentioned the steps where I had a similar conversation. Someone's like, my dietitian wants me to get to 150 grams of protein. I'm like, well, mathematically they're right, but have you shared with them that you're only getting 60? They're like, well, no. Right. I was like, well, maybe they would tell you to just do 80.
Exactly. Like, and if they knew that, they would. Exactly.
Yes, 100%. Yeah. Exactly. And then they would build you up to that. So like anyone, they, of course, they're template and they're spot on with wherever they got the number from, but that still doesn't, you still have to behaviorally get there and
it's real life. That's coaching. That's behavior change. Exactly. Yeah. It's there's something so special about this group of people though, because, I'm laughing because it's not special in a good way, but we are so, the experience of Joe, you really have to put yourself like in these people's shoes. Like they are so, you are awake, trembling in discomfort, probably running back to the bathroom with diarrhea 15 times. Your body internally and externally is in pain, on fire. You have anxiety constantly. And like, you're going to a doctor and they're like, you should take glutathione. Like it's like, they're not even close. And the symptoms are of nightmares, and it's unending for people. And then again, even me saying like go walking, but I mean it, by the way, I still mean it. It doesn't matter what, I still mean it. But it's like to understand that level of pain, and then the fear of it happening again after seeing hell and coming back from it, when a flare ends, it's just it's like a torturous cycle. And so for me, it's like it's pure joy to help people break that cycle. But I have to like crack in on my clients a lot from a nervous system perspective, because if they say they're not going to heal, they will not heal. It is that direct and it is that tangible. It's not a hypochondria thing. It is tangible. So it's a lot of that conditioning of like, how do we break your brain from the pattern it's in? That's a very rational pattern. You felt sick forever. You keep feeling worse no matter what you do. Why would you think it would change? We have to kind of trick our brains out of it.
Yeah. And I think there's a lot of course, there's some frustration and some defeat in that, but there's also a lot of hope I think it can give to people to say, if you're following influencer A or B, just understand that it's more broad advice. And a lot of times, if you are one of those people that's more sensitive to issues, it's not that it doesn't work for you. It's just not the right timing. You just have to clean some things up or fix a few things and start with, as you were mentioning, the kind of the crawl before you walk before you jog, and so on. Like start down here, but you're trying to start at the sprint. And I think I hear that a lot with people though, and they're just like, well, I might as well just be overweight and unhealthy, like to hell with it. And I'm like, I get it. I would feel 100% same way. Like I totally get it. It's just, you're just not working with the right person. And I've even told people before, back when I used to coach, where I'd say, I'm not the right coach for you. Like you need someone who's better at this and this. And especially in my 20s, like I don't have a lot of empathy. So
100%.
Now I do. But
you don't get it. You don't. Yeah, exactly. And that's fine. Right. But I also don't want a performance athlete coming to me. You know what I mean? Like, I'm like, I don't know what that is. I'm like, I'm just trying to have people not die. You want to go to someone who does performance athletics. Like it's, and that over time, obviously now that I've been in practice for over 11 years, like, people start to get that. Like, again, I used to work I lived on the Upper East Side in Manhattan for a long time. And it was like a wealthy clientele who was like, I want to lose 5 pounds. I'm like, it's not me. I'm like, you want to lose 150 pounds? Come to me. Like, I'm not the best person for it. I'm not even empathetic to your experience as much as you'll want me to be. And I'm not the best one to help you. Someone else who's like performance, precision, optimization based is your gal.
And that's an exciting place to work in, right? Because when you know your lane, you know what you're, passionate about and tied into. But speaking of passion and kind of your lane, I wonder, can you tell people just about, and I believe you have an upcoming webinar coming up. And I know we waited a bit in the episode to get to it, so we'll definitely have to cut this out so that everyone hears it in a short form as well. But can you talk a little about your webinars? What do you have going up? Where can people find info about it?
Yes. So I so excitedly, I just realized that I could post these Instagram posts, I could post podcast episodes, but I needed to like sit for a long period of time. So I started doing these histamine webinars that people can purchase or register the replays of if they ever wanted to. The first one we did was just histamine essentials and went through today, but in exhaustive detail. It was almost 3 hours. We did a Q&A at the end as well. Almost 800 people came. It was really, really exciting. And we answered a lot of questions, and it was just, to this day, I get messages about it all the time. It was just a joy to like really sit with people and really go through what they need. And now we're doing a second series with one of my best friends, Amanda Montalvo, RD, who is on Instagram as the Hormone Healing RD. Most people will know her as kind of like the mineral hormone queen. She's one of the like pioneers in how minerals affect our hormones. So our next webinar is going to be on female hormones and histamines and how they're related. So we're going to look at hormones through the lens of those with histamine issues or POTS and hypermobility as well. So I brought Amanda in because she is just one of the most knowledgeable people in the space on minerals and hormones overall. And we're going to go through PMDD, PMS. We're going to go through the actual cycle, endometriosis, which is very closely tied to mast cell activation syndrome as well. We're going to go through pre-pregnancy, post-pregnancy. We are going to go through any part of the lifespan and cycle of a woman's hormones, perimenopause, menopause as well. And I'm sure we're going to leave it all in the field, and I'm sure it will be literally 3 hours long. That's coming up September 28th in about a month.
That's awesome. No, it's great. And in the audience, is it a mixture of practitioners and kind of general population, or what would you say?
I I can't give an exact number of like 50-50, but
Sure.
I was so moved and impressed, and this could make me cry, but there were so many functional medicine doctors in the audience, and like, just, you know how the space is, like a functional medicine doctor coming to a dietitian's webinar. It's like a huge compliment to me, and it means so much. And
Sure.
just pouring out of messages from physicians, not even functional medicine doctors, just saying like, I'm using this in my practice. Like, I completely understand my clients differently now when you explain the science, because no one's explaining like POTS is a Gogurt tube treatment strategy. Like, it's hard to visualize, and we're not getting that in our education. We're just not getting the relationship between these. So yeah, it's a lot of practitioners, but a lot of people who are just experiencing things as well. But huge outpouring from practitioners that I was really moved by as well. Yeah.
Yeah, no, that's awesome. Definitely going to check that out for sure. I did want to hit a couple rapid fire questions as we kind of wind down here, if you don't mind.
Absolutely.
The first one is a day in the life of Michelle Shapiro. What are some healthy habits you do to keep energized and all
Joe,
that?
you already know what the first thing I'm going to say is. Walking in the morning.
I guess cliffhanger. Yeah, I guess I already kind of led you on that one.
That's one of the most important things. So I have to, I'm a major breakfast person. I try to get 30 grams of protein, 30 grams of carbs within 30 minutes of waking up. I'll always have electrolytes in the morning because I'm a horrible hydrator and I'll forget the rest of the day. And I get too busy like you. We're busy-minded people. We're cerebral. We're in our heads. And then I will go on a morning walk almost every single day, unless sometimes I have clients really early, like 7 a.m. or 8 a.m. I am also an 8 to 4 sleeper, like an 8:30 to 4:30 a.m. sleeper. I'm a very, very early sleeper. Even if I went to bed at 11, I'd still wake up at 4 or 5. It's just who I am, a very early clock. So I will get the morning walk in before clients. If I can squeeze it in between, I will meet with my team. I have 5 other nutritionists on my staff. They're the most amazing ever. We meet about every single client that walks through my practice. I work on recommendations with them, every follow-up, every initial consultation. I am behind them and supporting them as well, even though I'm sure they'd be amazing without me. We do it all as a team. So we'll meet together. We have a huge meeting on Mondays, and then I will see clients usually. It's different now, but like a lot of clients, like I used to see like 10 clients a day. And now I see like probably 6 clients a day. And then if I'm working on a little book that I might be working on, if I'm working on a podcast or something, I'll do that. But the morning is the most critical time of my day because I don't know when I'm going to hydrate or eat again or walk again. So I have to make sure it's jam-packed in the morning.
Got it. Awesome. All right. This is going to be a 2-part question. The first, though, is what is one health myth that you wish would just die and go away?
Oh my God, there's so many.
You can do more than that.
Yeah. I'm like,
free.
I just, I don't know if it's a health myth, but this is what I would say. Functional medicine was made to be this like brilliant way of viewing the body as so many different spiritual, emotional, and physical components that are all connected. And what it's turned into is people selling supplements. Mm-hmm. And the myth is that functional medicine is biohacking or longevity. Functional medicine is an intricate science based on the understanding of how every single part of our body and our soul is connected. So if you are seeing a functional medicine doctor and that doctor is just selling you supplements, they are not practicing functional medicine. And I am like a diehard functional medicine advocate. When I first understood what it was, I was like, oh my God, this is the thing. This is what is missing. And I still feel that way. But the myth is that functional medicine is about supplements or medications, and it's not.
Got it. Well, conversely, on the other end of that, what is one health tip that you wish more women knew about?
We mentioned it earlier, like health tracking and cycle tracking, I think is really, really, really important. And I know that many people do, but just get one of those apps, Ovia, MyFlow, like any of those apps, and just mark the symptoms, just clock them in, because looking back on your cycle, to have that understanding of your body, it's irreplaceable in our health and our lives. You have to understand what your body rhythm is telling you.
That's awesome. Well, I know you have a lot going on, so we definitely appreciate you taking the time to join us today and share all of your knowledge. This will all be in the show notes and put out there where people can find you. But just for those listening, maybe on audio as well, can you just walk through the best way to find you, get in touch with you, find information about your webinar, all the above?
Yeah. So I'm Michelle Shapiro, RD, on everything. RD, like registered dietitian. That's my Instagram. It's my website. You will find information about the webinar on my website in the bio of my Instagram. If you're on my email list, you'll see emails about it as well. You can join the email list through, again, michelleshapirord.com. If you ever wanted to be a client in the practice, it's really easy to apply in the bio or on the website as well. And you can learn all about our practitioners there. And again, any upcoming webinars will be on my Instagram, in the bio of my Instagram and on my website.
Awesome. Well, thanks so much for joining us. And for those out there, I let you know ahead of time that we were going to unpack a lot, and it definitely did not disappoint. So a lot of great stuff. And for all the viewers, be sure to like, comments, and send your questions in, because if our team can answer them, great. But if not, we'll be sure to shoot them over to Michelle to see if she can lend a helping hand there. But we definitely appreciate you coming on, Michelle, and for all those out there, thanks again for tuning into the First Optimum podcast. So we'll see you guys.
My joy.